Hi, and welcome back to Questions from Quarantine. I'm Tari Tyrell, and I'm here with Professor Juliette Kayyem and Dr. Margaret Bourdeaux of the Harvard Kennedy School. This week's question is for Juliette. Juliette, there have been a few businesses in Boston that are already starting to close down again after receiving out-of-state tourists from areas, particularly where hotspots are rising. I'd love to hear your opinions on why this happened in the first place, why they opened in the first place, and what you think the long-term plan should look like.
Well, I mean, I think it shows that we're only as strong as our weakest state as a nation. And I think that's actually also proof by what you're seeing, how the EU is responding to us. They could care less that Massachusetts is in good shape or that New York City is. We are a sick nation, and people are going to, and they're going to keep us inside. Inside the United States. That also means that for domestic travel, what you're starting to see is states have different rules for quarantine depending on where you're coming from. So I'm right now in Rhode Island for the month. Massachusetts is not, if you're from Massachusetts, you're not required to quarantine. A couple months ago, you were, right? In other words, if I had come here, I would have had to stay put for 2 weeks. All the masking rules and everything still apply. So that's good. So I'm not a big fan of indoor anything, let alone indoor restaurants. And I'm not a big fan of bars. I've been arguing that I've seen enough. Close all the bars. Let's have a stimulus package for the bars. We know what bars and indoor restaurants have all the attributes of what you don't want in terms of containing the spread. They can wait. We have we need to focus on critical infrastructure, including schools, which I would include as in schools now, work in terms of the work to support critical infrastructure and containing this virus. The economics of this are not working, right? Of opening up are not working. In Rhode Island, it's interesting. The governor Raimondo has done a great job and has been getting sort of national press on it. And one of the things that they're showing is because she took her time, the economic growth in Rhode Island is actually stronger than the rest of the United States. People feel confidence. We're overcoming that confidence gap. We're going out, we're doing it, we're taking it seriously. There's a strong masking rule. So that's, I think Massachusetts is probably going to have to slow it down. I don't know why Governor Baker is opening bars. I would not open bars and just limit indoor activity with strangers. It's just, we know how the virus works, and we know that we have to increase our floor. In other words, we're only going to be as strong as our floor at this stage. And without a national guidance in this regard, we're just dependent on governors. But this state-by-state aspect to it means that each state is going to have different standards. One final thing, I've been working with a group that's doing local and state policy, sort of figuring out what's going on state by state, because Donald Trump has sort of failed to take charge of this. And what they found is interesting is whatever the dynamics of Trump and masking and the politics of it, two interesting data points which give me hope in this time of when we're searching for it. I mean, the first is the polling is still very pro-science and health. I mean, Americans are listening to the mask wearers and the mask guidance and the social distancing and the confidence gap in 80 percentiles. Like, look, you're going to have that contingent that doesn't believe any of it and follows Trump. But that gives me hope that there's actually a sense of discernment. And when people lose family members, they wake up. The second is that state by state, we are getting to national policies. So whether it's the closing of bars or social distancing, as we saw earlier. So on masking, something like 68% of the American population is now under mandatory masking orders for if you go inside a commercial area or something like that, if you're outside your home. That's good. I mean, it's not ideal, but it does mean that it also means that in 48 of the 50 top cities, those are all under, or most populous cities in the United States, all are under mandatory masking rules as well. So we're hitting large proportions of the population, but just not in a unified manner.
I would also just sort of jump in on one point of this, strategy of going state by state. And I think at the beginning I was sort of like, okay, we can kind of make this work. I really have become much less sanguine about that approach as a workaround because of, again, this testing issue. our testing system, our companies that do it are just not regional, they're not by state. They are interconnected, as is interstate travel, right? And so I am very much hoping that this recent rise will be a motivation for some of the governors who have some convening power to be able to really reach out and lead to peer-to-peer and say, let's come up with some common approaches, some common standards, when we're going to close down, when we're going to, place certain rules on the books, how we're going to solve this testing crisis. Let's really, sort of figure this out. So, I think that that's frankly the hope that we have to go on today, is that governors will take the lead.
Great. Thank you both so much. Well, this has been Questions from Quarantine. Please feel free to hashtag us Questions from Quarantine for a chance to have your question answered next week. Thank you.